Anxiety and cannabis, a quite controversial subject because there are several people commenting us, okay, cannabis relaxes me, and the other part says, I cannot smoke cannabis, I cannot use cannabis because I get completely anxious. That's pretty paradoxical if we think about it medically, because how is it possible that one and the same substance creates anxiety and reduces anxiety? Well, this has to do with the dosing. It has to do with the tolerance of the patient, of course, but especially with the dosing. If we talk about THC, we have a biphasic effect. Low amounts of THC can reduce anxiety, and high amounts of THC, especially if we are not used to it, can create anxiety and panic attacks. So we have to keep that in mind if we start a medical cannabis treatment. CBD, at the other side, has a biphasic effect as well, but not regarding anxiety. CBD is always an anxiolytic, but for example, at lower amounts, it can be a little bit uplifting up to, but at high amounts, it's hypnotic. Well, regarding the treatment, what's the most important if we start to treat a patient with anxiety? That we need a high amount of CBD and a low amount of THC. If we start with the THC predominant product for treating anxiety, we are not going to have the outcome we are searching for. This is the first rule at all. The interesting part of treating anxiety with cannabinoids is that we don't have so many alternatives. We have St. John's wort, lavender extracts and stuff like this, which has most of the times not the potency we need for the patient. And at the other side, we have benzodiazepines, Xanax, etc., which can be used but should be used with a lot of attention, and especially not for long term. So this puts us doctors in a pretty complicated situation, because we can either treat with this ultra strong medication, or at the other side with this light medication, but we don't have the in-between thing. So that's what makes cannabis so interesting here. You have a group of drugs which is right in the middle. So with cannabinoid treatment, we can reduce anxiety without having that severe side effects long-term and that problems with addiction. This gives us a new tool to treat this kind of condition.